Bipolar disorder is predominantly a medication treatment, meaning that most people with bipolar disorder will require a mood stabilizer for the long haul, essentially. Forever, not necessarily, but often for very long periods of time.
Bipolar disorder is generally treated with mood stabilizers. These are medications that help work with both the highs and the lows of bipolar disorder so the mood is more neutral and more stable. This can be a medication like lithium that's been around for a very, very long time and is incredibly effective, or some of our newer medications like lamotrigine or carbamazepine that can help with stabilizing the mood.
So the other important factor in treating bipolar disorder is treating episodes, which is different from just staying on the mood stabilizer. Hopefully the mood stabilizer keeps you from having episodes, but if you do break through and have one, then in addition to the mood stabilizer, you would be on a medication to treat that particular symptom. So if it's depression, your doctor might add some antidepressant with the mood stabilizer to bring you out of the depression. If it's mania, then certainly you would require what's called an antipsychotic to bring down the psychotic symptoms of mania. So it can be complicated, and it's something that you need to work closely with your psychiatrist on.
We use ECT to treat bipolar disorder if the other medications are really not doing their job. So it might be somebody that's tried 2, 3, or 4 different mood stabilizers or perhaps an antipsychotic, and they're still particularly manic or depressed and it's not getting any better. Those are the times that we would think about ECT.
So medication is the mainstay of therapy, but in addition, psychotherapy is often helpful for people with bipolar disorder. So I wouldn't advise just getting medication and not seeing a therapist with some sort of regularity. There's first of all coming to grips with having a mental health issue that can be processed in a therapeutic setting, keeping tabs on sort of when you're on the way up or when you're on the way down and may need some additional medication.
If you're having thoughts of suicide, get support. Call a Suicide and Crisis Lifeline at 988.